Dr. Wenstrup, you're recognized.
Well, thank you, Mr. Chairman. I want to thank you all for being here, and I think that you've addressed so many of the issues facing us today very well. I do want to mention that I am a lifetime member of the VFW, and I joined about one day after I returned from Iraq, so I'm proud to be here. I want to do a quick shout out to those from Ohio that are here today. If you'd stand and be recognized, I appreciate it. Thank you very much. I also want to take a moment to recognize the student veterans of America that are here with us today on the behest of the VFW so they can learn the process and be part of the future generation of the VFW. If you'd stand and be recognized.
Don't have to do that now.
Thank you. You know, so as a doctor, I can tell you that most of the doctors in the United States at some time train in a VA. They spend some time in a VA, and that's just another tribute to our veterans who not only service in uniform and on the battlefield, but then come home and they help train the future doctors of America. And so for that, I thank each and every one of you. But I want to talk a little bit about one of the things that was mentioned, and speaking as a physician now, I do think it's important, and you mentioned this, that we have a relationship with a primary care doctor in the VA. And so when we talk about that situation, I want the primary care doctor to be the one to say, this is the doctor you need to go see for something in specialty. And whether that's within the walls of the VA or outside the walls of the VA, that's a decision that should be made between the doctor and the patient, and the doctor weighing in with the patient on the best decision on behalf of the patient. So when we get to that, obviously we're talking about choice here. And I would contend that we not call them non-VA doctors, but because I would contend that they are VA doctors, they're just not within the walls of the VA. As a doctor in our group, I can tell you I'm not the only veteran doctor in our group, and we actually have one of our doctors, his son went to West Point in Operation Enduring Freedom. So we're very VA-centric and veteran-centric, and we'd be proud to put the VA logo up on our practice and say that we provide care to our veterans. And I think that's the way we should approach it, that we are within the VA system. We're just not within those walls. And I think that will make more sense. You know, we talk about cost of care, and it's been in my crawl space since I got here that the VA can't tell us what they're spending per patient. And recently, an independent study was done that we became aware of, that when you add in physical plant and administration, insurance costs, the employees, the healthcare providers, that for a primary care doc, they're spending about $400 per patient visit. That's ridiculous. Medicare pays about $85 for that, and that doctor pays all of their own expenses. We've got to be able to look at those types of things to make sure that we are being productive and that we are able to see more patients, because that's a huge savings, and you can certainly help a lot more veterans if you look at that. One of the big problems we know that our veterans are facing, first of all, when you're sick, you have anxiety. And when you start getting bills that say you're not paying your bills when somebody else should be paying it, it doesn't make it any easier to treat that patient. I can promise you that. And that is something that we need to address. And I hope that you would be supportive where I'm coming from, that the VA doesn't have to be the claims processors. The doctors out there that are doing this are overburdened. They're overburdened because they have to send the entire medical record to get payment, and this and that doesn't happen when you're filing a claim anywhere else. I agree that the system needs to be integrated, and so that medical record is part of the VA medical record, but when you're talking about a claim, all of that information doesn't need to be there, and someone outside the VA who's very good at processing claims could be doing that for the VA, and I think we would solve that problem. And I hope that I have your support on that, and I'd love for you to weigh in on that, I think in particular Mr. Kelly.
Absolutely agree. What you just described as integration is what VFW envisions for integration. And today, a week ago, VA records, as you said, every documentation. If you went to physical therapy, and 4 times a week you went to physical therapy, that doctor had to submit every time you went to physical therapy for a month to be able to get that payment. That's a burden. But we absolutely need to make sure that at the end of that treatment, that doctor says, you know what, Ray Kelly's physical therapy went well, and I'm going to release him from physical therapy. Or send back saying, you know what, he needs another month of physical therapy. There can't be that blank space where VA doesn't know that more services are provided. So we wholeheartedly agree and look forward to working with you on it.
Thank you, and I yield back.
Mr. O'Rourke.